Thank you, John.
Fantastic. Thank you, Mai. Hello, everyone. I must just first apologize for my attire. My suitcase is somewhere between Addis and Cairo, hopefully closer to Cairo. But it's a great privilege to represent. We've called ourselves, even though we're a working group, we like the pun for a microscopy working group of a focus group to better understand the infrastructure and expertise landscape across the continent. And this is an idea that really kicked off 3 years ago at our very first community meeting in 2022. And so happy to share with you really just what we hope is kind of a first approximation, a baseline that we can all contribute to and continue to grow. So of course, for this audience, no introduction is necessary of why microscopy is important, whether that's in the biomedical sciences, which as a bioimaging consortium is really where we're at home, but also materials sciences, diagnostics, and so on. And already we've done tremendous work through initiatives like ABIC, AMI as well, to build strengthen capacity across the continent, build networks, establish imaging hubs. But of course, we all know that limited access to infrastructure, maintenance, training, coordination, and so on really restricts what we can do as a continent. And so that's really what gave rise to this focus group. We, as Precious mentioned, are very interested in understanding where are the microscopes on our continent? What are they? How did they get there? In what operational state are they? How are they maintained or funded? And so on. And who are the people who are operating the microscopes? Because the more we know, we can then build on this map that Precious showed us to be able to connect and share expertise as much as possible so we can really build this community from within Africa. And we know why this matters, of course, because by understanding these kinds of things, almost all of us are scientists, we're data-driven people, we need the data in order to make rational decisions. We can then help to identify in a constructive way the needs, the trends, the opportunities for investment, training, policy recommendations, and so on. So many of you, if not all of you, I hope have completed the survey. A link will come later as well. And I also have a poster presentation tomorrow, which has the QR codes. But you can also go onto the ABIC website. That's where everything is. We have both English and French versions of the survey. But essentially, we asked at the very beginning, whoever was completing the survey, to provide their personal details. And then we had a big question branch. So depending on whether you identified more as just a user of a microscope, but you don't actually manage shared microscopes, or what we call a core or microscopy facility, or the people we were really trying to get to from this survey, yes, I manage shared microscopes and or a microscopy or core facility. Different questions then came up. So in the case of the former, we really wanted to get from these people who are using microscopes, well, who then manages or administers the microscope that you use in order so that we can get in contact with them. But really the bulk of the data I'm going to share with you came from microscope sort of administrators, facilitators, managers themselves, where we encourage them to share details of all of the microscopes that they manage. So there were options to sort of add additional microscopes, or even just one if that was all that you were looking after. And then we asked for these kinds of granular details, the type, the name, the model, what operational state is it in, with many opportunities to specify other, so that we could get, really specific details from these folks. And that's why another layer that's going to come next is really to delve into the nitty-gritty of these data. And then once all the microscopes have been added, really trying to understand generally what are the conditions for users to access your microscopes? Do they have to pay? Co-authors on resulting publications, additional services your facility offers, again, so we can get an understanding of what the expertise is, what the needs are across the continent, and then what are some of the challenges your facility faces. And then finally, may we contact you for a follow-up interview in case we'd like to learn more about your specific facility or situation. So this survey was distributed widely through our and other networks. We tried to make it as short and accessible as possible, and we tried to incentivize participation as well. A lucky draw, really emphasizing the collective benefit to the imaging community. We learned a lot over the past year. For example, at last year's community meeting, there were some concerns expressed about how these data are going to be used, for example. So we put together an FAQ resource, again, both in English and in French, to help to allay these fears and to really explain very clearly what we're hoping to achieve with the survey. We then translated them from English into French to increase inclusivity and reach. And then I'll mention some of our ABIC members, many of whom are here today, who really then helped to champion this survey in their specific regions as well to ensure broader participation. And then something that we've started doing, but that we need to do more of, is following up specifically with those folks, those facility managers who were recommended or whose details were submitted to the survey to say, hey, someone uses your microscope, would you please contribute to the survey as we plan or as we understand this map of infrastructure and expertise across the continent. It was run through Google Forms. There's the link to the English version, and then just a quick histogram to show you the number of responses we received over the course of the survey. So we received 116 responses, at least from the time period, the 13 months or so, from June last year to the end of July this year. And we collected 104 unique data sets. There were some duplicate entries, so we were able to merge those. Where did the responses come from? And you can see a heat map of the continent here, most from Nigeria. Pleased to see that 3 were received from Egypt in the end, South Africa, Kenya, Algeria, all well represented. And what was very pleasing is that indeed, almost or over half of these responses were from those who manage the microscopes or facilities themselves, the kinds of people we were really hoping to get in touch with. What are their positions or roles? And this probably aligns quite nicely with Precious's pie chart from her presentation, in which she outlined the expertise of ABIC members. But a third, or a fifth, roughly, staff scientists, PI or team leaders, postgraduate students, also some representation from folks who identified as postdocs or as core facility managers. You know, in this case, people were also able to select more than one option, and also a handful of clinicians, commercial partners, suppliers, undergraduate students, which is very pleasing to see as well. And then in terms of their research focus or expertise, perhaps unsurprisingly on our continent, infectious disease being a big focus, but also neuroscience, cell biology, even materials, drug discovery, and so on. So where are the microscopes? So of these 57 facilities here in a very broad sense, whether that's from one microscope to multiple microscopes that the facility looks after, 106 instruments were reported. And again, you can see on this heat map, at least as a baseline or first approximation, where are these instruments? Many of these facilities, again, used very broadly, have only one microscope. Many facilities have more than one microscope, and so on, all the way to 2 facilities in South Africa and Kenya that have up to 7 microscopes. But just be aware, you know, again, facilities used broadly. In a case like the University of Cape Town, we're very fortunate to have many more than 7 microscopes, but those are split across different facilities. So again, it depends, I guess, how you want to represent these data. The microscope type, so perhaps unsurprisingly, many of these just transmitted light microscopes with wide field fluorescence microscopes being well represented, these being the workhorses, if you like, of so much of our bioimaging that we do. But then a number of confocal fluorescence microscopes, electron microscopes across the continent as well, and then some microscopes that were reported as fluorescence, but we're not quite sure what their capabilities are. And so, you know, a further step might now be to find out what specifically are those instruments. Good news, and perhaps unsurprisingly, is that our microscopes on the continent are used a lot, daily or multiple times per week. Also very good news is most of the reported microscopes were fully operational. A proportion of them I've called operational but, and you can see here some anecdotes of what may be problematic or need work, but this is good because we know where these instruments are and we can now target interventions to address some of these challenges. And then also our major manufacturers are represented across the continent as well, as one might expect. Most microscopes have been purchased, a proportion of them having been donated as well. And once again, here you can just see some anecdotes taken from the survey to just demonstrate the richness of some of the data we've been able to collect. And how are these instruments funded? Well, most of them either through grants or institutes, or even a combination of the two, with a proportion of them being user funded as well. And a third of instruments having live cell imaging capabilities, incubators, and so on, which of course, allows them to do very particular things on that microscope. What are some of the additional services that are offered by these, again, in a very broad sense, facilities? So most of these facilities offering support during experiments, but many helping users to plan their experiments, prepare samples, image analysis, with many providing all of these kinds of services. And what are the conditions for access to microscopes? Some are, or a large proportion of them, are free to use. Sometimes users are charged a fee. Again, sometimes combinations of the above, depending on the specific applications of the work. Again, some anecdotes presented here. What are some of the challenges that are faced? Well, regrettably, we know that it's not only microscopy infrastructure that needs work across the continent, but also really the things that just our bread and butter that are needed for research, things like electricity, a consistent water supply. Interesting to see the computer availability and or upkeep. So perhaps not even a microscope specific issue is a problem faced by many of our microscope facilities on a daily basis. Equipment maintenance, institutional support, even local technical support and expertise was also flagged by many of the respondents. Some did flag other challenges as well. And again, just to give you a sense of what these are, availability of a trained expert to use the microscope. Two managers report, we have no functional microtome, which is really challenging if you want to do things like transmission electron microscopy, for example. Importantly, and perhaps resonating with what we already know, when equipment is donated, there's no proper installation or maintenance of the equipment. So as we all know, getting the instrument is one thing. That's just the start of the journey. Someone has to install it, someone has to maintain it, someone has to be able to operate it as well. So hopefully this is a step in the right direction. This is our baseline. What was very promising to see is all those 57 who did respond, who identified as microscopy facility managers, were all happy to be contacted for a follow-up interview or recommend someone suitable. And maybe just some closing remarks here. I particularly enjoyed this first response. I need more training in this field to change everything about microscopy in my department and facility. And so this is really one of the great ways in which ABIC, with the training resources that are being made available, is really helping to upskill the continent from the inside out. We need assistance in training for image analysis, in capital letters there. Well, now that we know who they are, we can reach out to them and say, hey, these are the resources that we as ABIC can offer, and others, please take advantage of them. So what's next? Well, you saw on that map of the continent, there's still many countries that are blank. We need to gather responses from those underrepresented regions, or more responses from those regions in which we actually know there are more instruments but are not yet represented in the survey. And perhaps then these follow-up interviews will also help us to shed more light on those, using academic databases to really see where the microscopy related research coming out of the continent is, will be another way into the continent to see where the instruments that are doing that research. So perhaps next steps, we've got to disseminate this, I think, publicly in some way, because there are a lot of people who are going to be very interested in these kinds of findings, and we can really use as good kind of leverage when we need to make a case for microscopy in Africa. A lot more detailed analysis needs to be done, perhaps some meaningful correlations. I'm not much of a statistical person, but perhaps there's something that needs to be done from that perspective. And then we probably want to update the ABIC website, our map as well, to reflect some of these findings, maybe as part of an online dashboard. But of course, this is just a snapshot of where we are 2024 to 2025. We'll probably want to repeat this in time to track progress and trends. So it takes a community, or in this case, a whole continent, to manage the survey. So a big thank you to everyone who's on the screen, especially Precious and Karen, who've really helped champion this project, and Samira and others in so many respects, as well as support from industry, from abroad. Thanks very much, everyone, for your attention. As I mentioned, this will also be part of the poster session tomorrow. So if you'd like to revisit any of these findings, then please do come and chat. Thank you.
Thank you, John, for your talk. We have a question from Mike. Thanks, John. Truly remarkable effort that you put in, and to everyone involved. You touched on it a bit on the end, but I am curious as to what we need to do to actually digest this information and turn it into something um, where we have targeted impact. Do you have any ideas on how we do that, or do we still need to figure that out as a community?
Probably the latter, I think, because it is going to require. I mean, we're all a bit thinly stretched as it is. ABIC is busy, but we have now this rich data source, and we need to do a little bit more work in mining it, but also making available what we have and know already into some resource that can be used as part of our toolkit to do what we need to do and to leverage support from others and from abroad. So, I mean, these were just some ideas that came to mind. I'm not sure whether any of these resonate particularly with you at the moment, and maybe we can all give some thought to ways in which we could contribute to or support or, um, yeah, violently agree or disagree with any of these ideas.
Yeah, I think there might be a slight undertone to a lot of the talks today about the dire situation we're facing funding.
Mm,
And this could be a resource that's made available to help motivate for funding from
exactly.
all the different places that we look for it.
Mm,
And it could be a community resource that we just share and everyone has access to these statistics, because it really is a huge data source
mm,
and it's tremendously valuable.
yeah. Off the top of your head, what do you think would be the most useful way in which those would be presented in the form of a manuscript, some sort of document, even a slide deck in the way one might sort of pitch one's findings to
I think all of the above.
all
I
of the
mean,
above?
a white paper or a publication will be hugely impactful by just getting the message across, but being able to share this digested information easily and in a format that can be conveyed to another person very easily. So in the form of a slideshow or a template letter that is supported by ABIC that can be included in grant applications
Mm,
to say, look, we've done this survey. This is the state of the environment. And if a grant is trying to seek funds towards equipment, that we have a justification
yeah,
of why this is so important, and we
excellent.
provide that as ABIC,
Yeah.
just as an idea.
Thank you. Yes, and I hope that those will come immediately out of this meeting is let's prepare, even though, and I'd be interested to hear from you whether there are other insights you would like to see from these data that I haven't shared now already, but at least at this first step to quickly bung them into some kind of form, preferably multiple sort of modalities, so that we can immediately start using these data to further our cause. Thanks, Mike. Karen.
So I'm just going to piggyback exactly on what Mike said and just flip it and present a positive thing and then an appeal. On the flip side, this is an incredible resource for those who perhaps are looking for rapid access to equipment and they just don't know where it is.
Yeah.
And that was, to some extent, the entire intention behind the map, highlighting equipment and people. And I think this is just an extra step towards that. So agreed 100% with everything Mike said, and also that this is an amazing resource for the community now. If there is not additional investment that comes specifically where people need it to increase there, we at least know where stuff is and what is accessible. Um, an appeal / suggestion from the what do we do with all of this information. We need people who love playing with spreadsheets to help us extract and look at different ways to interpret all of this. Just putting it out there, if everyone's thinking about what they're going to do with their end of year break or something like that and wants to help us wrangle some spreadsheets.
Lisa has cleaned the data up beautifully for us. Thank you, Lisa. The spreadsheet is all good to go.
Excellent. I mean, yeah, there's always room for extra people to get involved here, and I think there's many ways to put this information out, as has been said. And I'll just echo my thanks to you, John, for you highlighted everyone who's been involved, but you pushed and pulled us at various points as needed, along with Precious, to get us to this point, and it's great. Thank you very much.
Great pleasure.
Hi, John. Thanks a lot. It's nice to meet you. So I kind of knew about everything related to the maps for 2 years, and I also added the microscope that we have, or microscopes on the map. It wasn't updated, but to be honest, I used it to my advantage. When I approached donors, I was like, look at the black hole that is the north of Africa. We have nothing. Look at the rest of Africa. So in a way, an updated map is very helpful. Maybe there's just like a lag period, but the fact of the matter is the gap in information is very important for the donors. Every time I show the map, people ask me, why is it that Nigeria and Kenya and South Africa have a lot of resources? And so your data includes this data, which is like if you can classify the countries into groups based on numbers, and then it's good for me to know how long did it take to reach this number in South Africa. Is it mostly based on donations or is it funds? Like if I want to copy a successful model, what does it take to copy it? And not just like absolute numbers that is like covering the variability. And the variability is very important for us to know, not just because countries are different, but because legalities are different. We have very hard and different like laws between countries. So even if I dream, my dream might not happen. You know, like I might be thinking I can get 10 microscopes, but then my country says they are used. You're not getting them. So just like, are they all first-hand microscopes? Did they have second-hand models? Like what? How was this achieved? Is in your data. I'm very happy to play with data because I love it. But I think what is important is to come up first with what is the information that we want before we start data mining. Like if you come and say, I want to publish a commentary, because that would be amazing. Like I can imagine that would be very useful in a microscopy, like Nature Methods, commentary imaging in Africa. Yeah. What are the hurdles that these people are facing? Is it just because they have no money, or because they are not communicating with each other, quote unquote? Yeah. Or are they just like focused on techniques that are fancy but not producing fast results? You know, like a couple of these things. The last comment is language. Like, I understand your use of English and French very well, but you have to bear in mind that some of the people we approach want an Arabic version of that.
And
We are
respectfully
very happy
acknowledge
to
that.
help with the language. Like, we can translate and help with this aspect if need
Fantastic.
be. Yeah.
Wonderful. Thank you so much for all those potent questions, nudges. Yes, very well taken and noted for the future. Thank you.
Yeah, thank you. Thank you very much for your sound paper presentation. But my worry is when you begin to talk of you have 20 microscopes in Nigeria, are you not going to compare it with the size of the people, the population?
Yeah, I mean, there needs to be some sort of, I don't know, normalization or waiting, for want of a better word. Perhaps, I don't know, number of institutions, GDP, research output, perhaps, because it's not a number. I mean, in some ways, it is a numbers game. That's what this very superficial analysis suggested, but it is more subtle and nuanced than that.
Then, when you say, using the word microscope, are we talking of microscopes that are available to students just for teaching or for research? Because they are different. They are quite
again,
different.
a good question. And we realized maybe that's a limitation of the surveys. We weren't clear about that up front. It does seem from the responses as a kind of first pass that most of these are research instruments. There have been specific cases where folks mention, no, these are specifically for, or we have other instruments available for teaching or routine diagnostic purposes. But its research would certainly be, I'd say, the sort of 90% case of these.
Finally, I think I saw electron microscope. That's too broad. Can't we say trying to look at the breakdowns, scanning, transmission?
Probably, and there I must acknowledge some analysis bias there. Being a light microscopist myself, I don't think I know enough, but we have the make and model of most of these instruments. So the next level of diving into should be able to unpack the electron microscopy modalities.
Okay, thank you so much.
Also, great points, much appreciated. Thank you. If we do have time, I think just one more at the back. Thank you.
So I wasn't sure if you mentioned this point, but it would be interesting to see the countries that has higher number of microscopes, what kind of research exactly they're using it in. Because I know for sure, for example, here in Egypt, most of the use of the, at least the confocal microscopy and the TIMS are used by the dentists to look for like materials and structures. However, once you go into more biology, you'll hardly find any use for confocal because simply they don't use cell lines as much. They don't know about the technique. They don't know about immunofluorescence. And even if they know, it's expensive to get the antibodies. It's expensive to get the clones. So maybe a part of the limitation is not about just getting the machine. It's again the cost of doing an experiment that can simply be having availability of cell lines rather than a tissue or a material science use, which is more easy and more affordable to execute on any of these machines. So having this would also give us some clues about why there is a limitation or a gap in some countries versus another.
Brilliant, thank you. And just again goes to show how wide and broad a church is, if you'll excuse the collective noun for something like microscopy is, because we use it for so many different things in so many different ways, constrained by so many limitations. And it would be good to reflect as many of those aspects as possible in this kind of report, so we can really represent the community in kind of an inclusive and broad way. Thank you. Oh my goodness, really being grilled here. Hello, Bernard. Hi, everyone. Yes.
All right, that's quite wonderful research. My interest would have been like if you say there are 20 microscopes in Kenya, then I would be interested to know are they light microscopes? Are they confocal?
Yep.
Those kinds of details, and I also would be interested in what he asked about. Where are these microscopes?
Yes.
Are they, which part of that country are they, and what are they being used for? Is it for training, for research? That bit will really help to at least map out and know whether, and also access to those microscopes.
Precisely.
Whether they're being used for research, whatever, and how are they accessible to the guys in that institution. And that will help us also.
Exactly, thank you. So we've got those data, now we need to figure out a way to present it, and it's precisely that kind of granularity that we can now really look into, perhaps as part of the map on the ABIC website. If we are able to present our data as part of that map, then you can very easily zoom into the country and see, oh, that's the distribution per institution, the type of microscope, what it's being used for, and so on. But yeah, to Karen's appeal, we need extra hands now to help us with these analyses as well.
Thank you, John. Mine is more of comments and request. Your data is it's great and it's true. Coming also from Kenya, I've realized that yes, they're there, but I think what we need to pull up or trying to reduce the gaps is by introducing a culture of sharing, a sharing culture. Because the institution I'm coming from, we do a lot of biomedical research, and we access samples from hospitals, among others. And I've realized some of the hospitals, especially private, they have some of these good microscopes. So like a request, if you can bring the next meeting to Kenya, God willing, we can, by calling these people, we also include clinicians, people like clinicians who are already using this microscope, and then we come and try to see how we can share this stuff, because if we are sharing a project, we also can share the microscope.
Absolutely.
And in our institution also, we have, we do research and also train students on internship. So it's also a good environment to welcome different from universities, from research institutes, and also from the hospitals. Yeah, to just make sure that there's this sharing culture to improve in the future.
Thanks for that point. Yeah.
And also, we are also ready to help you with the data.
Yeah,
if you need extra hands.
Very generous. All about building the community, as you say, sharing, no need to reinvent the wheel, and we can all learn so much from one another rather than having to start from scratch as well. Thank you.
All right, thank you so much. My name is Emmanuel. I'm from Uganda. I would like to thank the community for bringing us here today. Yeah, I have an idea for this community to be bigger and much more helpful to the outside world. We could actually think of setting up some private imaging centers across Africa so that we can easily get access to our data for research and for maybe patient outcomes, something like that. And that would be good because like in Uganda, we have a lot of restrictions to access such kind of data. So the public hospitals around, you may not get access to some kind of work like imaging. So we could actually, through the community, come up with some private centers actually.
Just check if I understood. You're asking for an imaging center which is open for Africa. Okay, so we have Mike is in the next talk. Having Mike. Your dream had just come true like in a second. He's gonna talk about the Africa Microscopy Initiative. It's an imaging center in Cape Town. It's open for every country in the continent. So you're gonna know more about this. So yeah.
Thank you, John, for your presentation. I'm Agathe Fotio from Cameroon. I saw just 3 microscopes in Cameroon, but I think that is underestimated because people there are afraid to share the information because of the scarcity of microscope. They are afraid that they will have hush demand and people will come in their lab after spoiling their microscope. They will not be able to maintain it. So I would like us to have much time next time for the survey so that at least we can make the call or we can at least call them or go individually to meet some people, especially clinicians and even other researchers that have good microscope, explain the importance of the survey to them so that they can agree to fill the survey and send so that we have maybe the exact number of microscopes that we can have in our country. Thank you.
Thank you. That is an issue or challenge we've encountered, and if perhaps you would be willing to facilitate those kinds of conversations. And I mean, again, it's all about good communication and sharing. And I think once one understands our intentions behind this survey, probably find everyone would be very willing and happy to share. We just need to make sure we're reaching the right people in the best possible way. But thank you for flagging that. I mean, that's an interesting challenge when we report these data as well to highlight as well.
We're having a final question in here. And then
Emmanuel.
On with.
Thank you, John, for this presentation. I think this is extremely important to map everything. And my first question is, what do you think, how much we are underestimating the survey, because like this is a good slide. It's like we have a lot of countries we have not reached. And the second point is about funding and those things. I think one thing we should have do also is like try to understand how many times these microscopes have been used to publish a paper.
Yes.
And this one, and yes, that's main. And the second thing is funding. Also not only in Africa, I'm also a little bit in Italy sometimes. So even there, they are not so strict like here, but they are reducing. And moreover, they're moving to translational and patient data and diagnostic, always related to basic research, but we have also to think about how to reach the patients.
Yeah, absolutely. Brilliant point. Your first part of your first question, how much we're underrepresenting, or at least undercounting the true situation. Gosh, let's have if we have a drink later, then maybe we can be a bit more realistic about that.
Thank you.